Your implant's been placed, and I've got a few instructions for you for the next couple of days. The first is I don't want you to swish or spit or just touch that area at all. You might feel a little metal post that's sticking out through the gum, and that is perfectly normal. We're going to ask you to bite on a moist gauze if you have any bleeding. Now, if that bleeding continues, you can also use a tea bag. Just dampen the tea bag and put that in and bite nice and firmly. We're going to ask you to do that for 20 minutes. If the bleeding continues over a long period of time, say 4 or 5 hours, please ring the office and we'll be happy to talk to you about what we need to do next. You may experience some swelling after the surgery, and this is perfectly normal. What we'd ask you to do is use the ice pack on the side of your face where the surgery was done for 20 minutes on and 10 minutes off, and repeat this for the first 24 hours. It's also a good idea to keep your head elevated. This helps relieve any swelling. You may experience some slight discoloration or bruising, and this is typically normal and it will go away within the next 7 to 10 days. We'd like you to drink plenty of fluids following your surgery, but for the first 24 hours, do not drink using a straw. Avoid hot foods, crunchy and crispy, and when eating, avoid the surgical site. You can return to a normal diet as soon as possible after your procedure, but soft foods will be best for the first couple of days. Take all medications that have been prescribed to you by our office as instructed. If you have been given pain medication by our doctors, you cannot drive. If you've been given a course of antibiotics, you must complete the course. Oral hygiene is important after the placement of your implant, and we would like you to start rinsing out with warm saltwater mouthwashes the day after your surgery, at least 4 or 5 times, especially after you've eaten. For many of our implant patients, we will place sutures. These sutures are resorbable and they will go away within the first 7 to 10 days. You may become aware of them, but just be patient with them as they do go away. If you're a smoker, please listen carefully. We do not want you to smoke for at least the first 5 days after your surgery. It is very important as it delays healing and is the main cause of post-operative implant complications. Following your implant surgery, we would like you to keep your physical activities to a minimum as it may cause bleeding. If you do decide to exercise and the bleeding does start, please discontinue the activity. Flippers, partials and full dentures will be allowed to be worn after the surgery unless otherwise directed. Please do not hesitate to call our office following your surgery if you have any concerns. If it is after hours, please call the office and our answering service will be happy to help you. And remember, we can only help you with prescription refills during regular office hours. Please don't worry about your implant surgery. Most of our patients have no concerns at all, and we are always here to help.